Colon cancer ranks as the third most common cancer in the United States, yet it's the one we often shy away from discussing. Isn't it time we change that? Today, we're lifting the veil on a topic that's often brushed under the rug, a topic that's crucial to our health and well-being, yet somehow still manages to be controversial: colon cancer. This disease is no small issue. It's the third most common form of cancer in the States. Yet despite its prevalence, there's a certain reluctance to discuss it openly. It's almost as if we treat it like a taboo subject. But why? Why do we shy away from discussing something so pivotal to our health? Is it fear? Is it discomfort? Or is it simply lack of awareness? Whatever the reason, it's high time we broke away from this cycle of silence and brought colon cancer into the spotlight. You see, colon cancer, also known as colorectal cancer, doesn't always make its presence known with glaring signs and symptoms. In fact, in the early stages, it often doesn't show any symptoms at all. This makes it all the more important to have a clear understanding of what to look out for. So, let's start the conversation today. Let's talk about the different types of colon cancer, the most common being adenocarcinomas. Let's discuss the risk factors from age and family history to lifestyle choices. And let's not forget about the importance of regular screening, which is recommended starting at age 45. This is not just about spreading awareness, it's about empowering ourselves and those around us with knowledge. It's about understanding our bodies better and taking proactive steps towards our health. So if colon cancer is so prevalent, why don't we know more about it? Let's dive into the signs and symptoms of this silent killer. The tricky part about colon cancer is that it often doesn't show any symptoms in its early stages. That's right, folks. This disease is a silent infiltrator, quietly making its way into your body without any grand announcement. This is why it's often referred to as a silent killer. It's like that uninvited guest at a party who slips in unnoticed, and before you know it, they've eaten all the snacks. Early on, colon cancer behaves like a ghost, leaving no trace of its presence. You won't see any of the telltale signs like blood in your stool or changes in your bowel habits. It's a sneaky little bugger that doesn't like to make itself known until it's well and truly settled in. This is what makes it so dangerous and why it's the third most common cancer in the United States. Now you might be wondering, if it doesn't show symptoms, how on earth can we catch it? That's a great question, and we'll be getting to that soon. But first, let's talk about some of the signs that might start to appear as the disease progresses. As colon cancer grows and evolves, it might start to make itself known. You might notice some changes in your bowel habits. Maybe you're going to the bathroom more or less frequently than usual, or perhaps the consistency of your stool has changed. You might also start to see blood in your stool, which can be a real wake-up call. Pain is another sign that something might be up. This could be anything from a general feeling of discomfort in your abdomen to a sharp, stabbing pain. And let's not forget about fatigue. If you're feeling unusually tired, and it's not due to a Netflix binge the night before, it might be a sign that colon cancer is making itself at home. But remember, these symptoms don't necessarily mean you have colon cancer. They could be signs of other health issues, so it's crucial to get them checked out by a doctor. Silent, but deadly indeed. But what happens when colon cancer does start to show signs? Well, that's where we're heading next, so stay tuned, and let's unravel this mystery together. When colon cancer begins to make itself known, it does so through a range of signs that may initially seem unrelated. So, what are these signs that we're talking about? Let's dive right in. The first sign that we'll discuss is a change in bowel habits. This can be anything from diarrhea, constipation, or a change in the consistency of your stool that lasts longer than 4 weeks. Now keep in mind that occasional changes in your bowel habits are common and usually nothing to worry about. However, if these changes persist, it might be time to have a conversation with your healthcare provider. Another sign of colon cancer is blood in your stool or rectal bleeding. This is a symptom that should never be overlooked. The blood may be bright red, or it may make your stool look black and tarry. It's also possible that the presence of blood is so minimal it's not visible to the naked eye, but it could still be detected during a medical test. If you notice any form of blood in your stool, it's crucial to seek medical attention immediately. Abdominal discomfort is another sign that colon cancer might be lurking. This discomfort can manifest itself in several ways, such as cramps, gas, or pain that doesn't go away. It's easy to dismiss these symptoms as a result of a heavy meal or a stressful day. However, if they persist and become more frequent over time, it's time to take them seriously. Feeling that your bowel doesn't empty completely, unexplained weight loss, or feeling fatigued can also be signs of colon cancer. Fatigue can be particularly tricky to link to colon cancer because it's a common symptom of many conditions, including just being busy. But if you're feeling tired all the time, even with plenty of rest, it's worth discussing with your doctor. It's important to remember that having one or more of these symptoms doesn't necessarily mean you have colon cancer. Many of these symptoms can also be caused by conditions that are not cancer, such as hemorrhoids, irritable bowel syndrome, or infections. However, if you're experiencing any of these symptoms and they're persistent, don't wait to talk to your healthcare provider. Remember, these signs are not to be ignored. They could be the key to catching colon cancer early. While anyone can get colon cancer, certain factors can increase your risk. This is a truth we must acknowledge. Age, for instance, plays a pivotal role in colon cancer incidence. The majority of people diagnosed with this condition are older than 50. It's not to say that younger individuals are immune, but the likelihood increases with age. Family history too can be a significant determinant. If your parents, siblings, or children have been diagnosed with colon cancer, your risk may be doubled. Certain genetic syndromes passed through generations of your family can also increase your risk of colon cancer. Now let's talk about lifestyle choices. They say we are what we eat, and in the case of colon cancer, this couldn't be more accurate. High consumption of red and processed meats has been linked to an increased risk of colon cancer. On the other hand, diets rich in fruits, vegetables, and whole grains provide protective benefits. But it's not just about food. Physical inactivity and obesity can increase the risk of colon cancer too. Regular exercise and maintaining a healthy weight are not just good for your heart, but can also keep colon cancer at bay. Let's also touch on the subject of smoking and alcohol. Long-term smoking is associated with an increased risk of colon cancer. Similarly, heavy consumption of alcohol can increase your chances. Moderation, or better yet, avoidance of these habits, can tip the scales in your favor. So what does this all mean? It means that while we can't control our age or genetic disposition, we can certainly control our lifestyle choices. Regular exercise, a healthy diet, and avoiding harmful habits can not only improve your overall health but also reduce your risk of colon cancer. Screening is another critical aspect that we'll delve deeper into in the next scene. Regular screenings, especially for those over 50 or with a family history of colon cancer, are crucial. They can help in detecting colon cancer in its early stages when it's more likely to be curable. Your lifestyle choices and age aren't just numbers and habits. They could be the difference between early detection and late-stage diagnosis. And that, dear listeners, is a choice we all have the power to make. Screening isn't about finding cancer, it's about preventing it. Let's pause for a moment and let that sink in. The idea of screening, particularly for colon cancer, isn't to find an existing problem, but rather to prevent a potential one. It's about catching the early signs, the whispers of a disease before it roars into a full-blown health crisis. Colon cancer screening is an essential tool in our medical arsenal, a tool that can quite literally save lives. It's a bit like a detective, meticulously searching for clues that point towards the presence of cancerous cells. It is this early detection that forms the bedrock of successful treatment. After all, the earlier a problem is identified, the sooner it can be addressed. Now, you might be wondering, what does this screening involve? Well, there are a few methods that doctors commonly use. First, there's fecal testing. It's just what it sounds like, an examination of your stool to look for blood or other signs of cancer. It's simple, non-invasive, and can be done in the privacy of your own home. Then there's the colonoscopy, a more detailed examination that allows doctors to view the entire colon and rectum. During this procedure, a thin, flexible tube is inserted into the rectum, providing a live video feed of the inside of your colon. It's a bit more involved, but it provides a comprehensive view that no other test can match. Blood tests are another tool in the screening toolbox. They can't diagnose colon cancer on their own, but they can provide valuable information that can help guide further testing. They're like the supporting actors in this medical drama, playing a critical role in the overall performance. But here's the thing, screening isn't a one-time thing. It's not a do it once and forget about it kind of deal. Regular screening is key, particularly as you get older. The risk of colon cancer increases with age, so regular checkups become even more important. So let's recap. Screening is about prevention, not just detection. It's about identifying potential problems before they become actual ones. It involves a variety of methods, from fecal testing to colonoscopies, and it's something that should be done regularly, especially as we age. And remember, screening isn't just for those who have symptoms or a family history of colon cancer, it's for everyone. Because the truth is, colon cancer doesn't always announce its arrival with clear signs and symptoms. Sometimes it sneaks in quietly, silently growing without causing any noticeable discomfort. That's why screening is so incredibly important. Screening can save lives, it's as simple as that. So let's make prevention a priority. Let's make regular screening a part of our health routine. Because when it comes to colon cancer, early detection isn't just key, it's life-saving. Don't wait until it's too late, take action now. That's the message we've been driving home throughout this video. Colon cancer, or colorectal cancer, is the third most common cancer in the United States. It's a silent enemy, often showing no symptoms in its early stages. This is why understanding the signs and symptoms is so crucial. Changes in bowel habits, blood in stool, and abdominal discomfort can all be indicators of late-stage colon cancer. But remember, it's not all doom and gloom. We've learned that there are steps we can take to mitigate our risks. Lifestyle choices play a significant role in our susceptibility to this disease. Healthy eating, regular exercise, and avoiding certain risk factors such as smoking and excessive alcohol consumption can all contribute to a healthier colon. And let's not forget the importance of regular screening. Starting from the age of 45, it's recommended to undergo tests such as fecal testing, colonoscopy, and blood tests. These can aid in early detection and dramatically increase our chances of successful treatment. We've also discussed the different types of colon cancer, with adenocarcinomas being the most common. The type and stage of cancer will dictate the treatment options, which can range from surgery to chemotherapy and radiation. In closing, we want to emphasize that knowledge is indeed power, and in the case of colon cancer, it could be the power to save your life. So, let's not shy away from these discussions. Let's take control of our health and make informed decisions. This was an enlightening journey, wasn't it? Well, there's plenty more where that came from. So don't forget to like and subscribe for more empowering health information. Remember, the more informed you are, the better decisions you can make about your health. Knowledge is power. And in the case of colon cancer, it could be the power to save your life.